Good evening, everybody. I'd like to welcome you to the Town of Harwich Board of Health for Thursday, February 20th, 2025. As required by law, the town may audio or video record this meeting. Any person intending to either audio or video record this open session is required to inform the chair. Nobody's doing that? Good. I'm going to call the meeting to order. Under the public comment, we're going to take the first two, and then after that, we are going to move the work sessions out of order and move them up next. And then we can finish our business, and you guys can go home if you want to. All right, we'll start out with the Food Service Excellence Awards.
Good evening. It is my pleasure to present the 2024 Food Service Excellence Awards. This new initiative recognizes food establishments in Harwich that consistently demonstrate a commitment to food safety. The program runs from January 1st to December 31st each year for both seasonal and annual establishments, with winners determined by a point system based on unannounced inspections conducted throughout the year. These inspections assess food safety practices, cleanliness, staff training, and overall adherence to health standards. The businesses we're honoring tonight have maintained exceptional food safety practices and truly stand out for their dedication. Food safety is essential to our community, and these awardees have gone above and beyond to ensure the health and well-being of their customers and staff. I'd like to extend my thanks to all of our local businesses for their commitment, as well as our health department staff for their efforts in conducting inspections and supporting these businesses in maintaining high standards. Now let's take a moment to recognize the winners of the 2024 Food Service Excellence Award. As your name is called, please come forward and receive your certificate. And I know Jen Singleton really wanted to be here to honor you with these awards. So she extends her thank you and gratitude to your efforts as well. We'll start with our risk level 3 category, which is George's Pizza, Heart of the Sea, and Subway. Thank you.
Good job. Good job. Thank you, sir.
Our risk level 4, we have 3 monkeys.
Me. Right. I have a question about what that means. What's risk level 4 mean?
Risk level 4 means that you serve a higher level of food safety. So the practices that are in your establishment are the highest of concern, and you're doing a great job. So,
Thank you. Appreciate it, guys.
You're welcome. Thank you. We have Ember Pizza and Red River Barbecue. Thank you very much. So we appreciate all of your efforts this year, and we hope to see you again next year to offer you the same awards. Feel free to stick around for our presentation and the rest of our meeting, but you are free to go, and we appreciate you coming out tonight. Thank you.
Thank you. Congratulations on a good job.
Yes.
Thank you so much.
And good food.
And good food.
And we'll be looking for that hanging in your establishment when we come in.
Absolutely.
I'll be there.
Okay, you want to announce number B?
B.
B, yeah. Yeah.
Presentation by Lisa Morrison from AIDS Support Group of Cape Cod.
We have Eliza online.
I am here. Thank you so much. I'm going to try and connect to my camera. Hi, everyone.
Hi.
So I am going to try and share my screen. I've not used this platform before, and it doesn't look like I'm able to be a presenter currently. Is there anybody that can switch me over or give me?
Yeah, are we able to?
So presenting again?
Yes.
Yeah.
Oh,
Try it now.
should work now, Eliza.
Okay, great. Let me see. Perfect. All right. Is everyone able to see that?
No.
No.
Oh, now we do.
Yes.
Yep.
Oh my gosh, that's amazing. It never works on the first try. So anyway, thank you to Carrie very much for giving me the opportunity to present to you all tonight. The AIDS support group was one of the recipients of some of the Harwich Town opioid remediation funding. And so we just wanted to take this opportunity to tell you a little bit about some of the work that we do, who we are as an agency, and then some of the initiatives that we hope to be a part of going forward. If you all have any questions, I'll pause at the end and we can take questions, but obviously if you have anything pressing as I go along, please feel free to kind of interject. So I am the Director of Harm Reduction Services at the AIDS Support Group of Cape Cod. Again, my name is Eliza Morrison. And I always like to start out by just reading our mission statement. So our mission statement is that the AIDS Support Group of Cape Cod saves lives through prevention, education, and life-sustaining services that address public health crises to build healthy communities across the Cape and Islands. So our guiding principles are, we are an organization that is rooted in harm reduction. And what harm reduction does is it meets people where they're at. So we don't require that anybody who comes to access our programming, whether it be testing services, substance use services, medical case management services, et cetera, be abstinent from substances or any behavior in order to access our services. What we do recognize is that there are many behaviors that carry risks. So as an organization, it is our mission to help to provide people with tools and education and community education to help to lower some of those risks that could potentially be associated with those behaviors. A lot of our harm reduction work is in regard to substance use, primarily opiate use. So some of the things that we offer at the AIDS support group is medical case management for people who are living with HIV. We have a food and nutrition program. We provide short-term health navigation and linkage to care in the community. We have a behavioral health component to our programming where we provide linkage to behavioral and mental health services. And we also offer groups in the community for substance use. We offer housing assistance services where we have a specialized housing worker who can work with folks who have history with substance use or perhaps are actively in treatment for substance use or at risk for overdose to find housing opportunities or potentially maintain housing in a way that they might not be able to access those services in other places like Housing Assistance Corporation. So we have a housing worker that's working under a specific grant that's specific to folks who've been impacted by substance use. And we also have a prevention and screening program, which provides cost-free STI testing for anyone in the community who's interested. So our testing panel tests for HIV, hepatitis C, and other sexually transmitted infections. We provide linkage to care for STI treatment, sexual and reproductive health services, housing, mental health services, substance use services. We are able to link people to primary care. Almost, we are able to do a warm handoff for kind of like emergent issues with some of our folks. Usually same day, we are able to help people access medications for opiate use disorder, usually the same day, and that's through like some of these partnerships that we've built in the community. We also provide access to PrEP, which is a daily pill that prevents HIV, and PEP, which is a medication that can be taken within 72 hours of a potential exposure to HIV to reduce people's risk by about 95% of contracting HIV. A big part of what we do is overdose prevention education. So we do a lot of education in the community, including Narcan training and distribution. We are a syringe services program, so we provide access to sterile syringes, syringe disposal, and syringe retrieval services in the community. Like I mentioned before, we provide linkage to care for addiction, including referrals and transportation to rehabilitation centers, detox, if that's something that people are interested in. We also provide post-overdose services. So we work with local first responders, we work with local primary care providers, different substance use support groups, health centers, and individuals in the community to support people after they've experienced an overdose. We also are able to work with families and help them to access some supportive services as well. So just some of the benefits of bringing harm reduction as a support for other services in your community. We provide prevention programming. So we do some work with some younger peer groups. So we talk a lot about substance use, different substances, and provide overdose education and awareness as well. We provide cost-free testing to folks in the community. We provide harm reduction strategies and supplies that are sterile to people who use substances. We provide safe disposal of syringes in the community. Our numbers on a yearly basis of syringes that we take in are always greater than the amount of syringes that we distribute. So that's really good. It means that people are potentially collecting syringes for their friends or other people they know to be using substances. They are syringes that we're picking up in communities. They're syringes from people who use them for medical purposes and not just substance use as well. We also provide a lot of community training and Narcan distribution, like I talked about. We oftentimes act as a bridge to community services for folks who may not otherwise be comfortable accessing services in the community like primary care or perhaps like inpatient or outpatient programming. People who use drugs experience a lot of stigma, and so we kind of act as navigators to help people to get into care that they may not have been able to access before. The data shows that areas with harm reduction programming have lower rates of overdose, HIV, and hepatitis C. It's a cost-effective way to save taxpayer money. So supporting distribution of Narcan, supporting distribution of sterile substance use supplies is much lower cost than to support people in support people who may need assistance being treated for HIV or hepatitis C or substance use disorders, et cetera. Also, communities with access to Narcan have lower rates of overdose. So one of the ways that we provide services in the Lower and Outer Cape is with our mobile outreach van. So this is a smaller van and it's discreet. We are out in your community already. We were out in Harwich actually earlier this week. We usually come through on Wednesday afternoons. We have some participants that we engage with on a regular basis in the Harwich area. We can provide almost all of our services on the mobile unit, which makes it really accessible for folks who may not otherwise have transportation, but it's also a great way to get Narcan and education out into the community by parking different places. So in the future, we really hope to have the mobile unit out and about a bit more in Harwich. It's a great way to start talking in the community about substance use and Narcan and different services that we provide and different services that we can link people to. This is just briefly about our post-overdose program. So POST is our post-overdose support team. It is a follow-up program where when we get a referral or somebody discloses that they have experienced an overdose, we try to connect with that individual within 24 hours to offer them support. We're looking to serve anyone who needs support. So they could have experienced an overdose a year ago and they would still qualify for this program. This is also for people who live with people who've experienced an overdose. This is also support for people who have responded to an overdose because we do acknowledge that that can be an extremely traumatic experience. So one of the big things that we do as an organization is overdose education and Narcan distribution. So part of our mission is to teach the community that overdose is preventable and that Narcan's easy to use and it's easy to carry. So Narcan nasal spray, I'm sure that you're familiar with the name, but it's a prescription medication that is used for the treatment of a suspected opioid overdose or emergency. We provide prevention training and Narcan distribution free of charge for anybody who is interested. So we can deliver Narcan at a training. We can, people can walk into any of our sites and get it. Narcan is legal to carry in Massachusetts. We distribute it cost-free. You do not need a prescription, but you can access Narcan at your local pharmacy. Everybody in Massachusetts actually has a standing prescription for Narcan. So we try to distribute as widely as we can and encourage as many people in the community as we can to learn about how to administer Narcan and recognize an overdose. One of the things that, one of the initiatives that, Carrie has really expressed some interest in for the town of Harwich, and I know that folks are on board locally, is the installation of nalox boxes, or sometimes they're referred to as sandboxes in the town of Harwich. Some of the boxes are called sandboxes after the Good Samaritan Act, which protects bystanders who respond to an overdose. So the mission of these nalox boxes is to improve the capacity of bystander rescuers to save the lives of people who might be experiencing an overdose. It's also, these boxes, when mounted in public spaces, are also a great way to decrease some of the stigma that's associated with substance use. And it's a great conversation starter about substance use in the community, and also a good opportunity for towns to use that box as potentially a space where they can mount some rec cards that might have local services, which would be available to individuals who have concerns around substance use. We currently have about 52 of these boxes on Cape Cod. I believe that Harwich potentially has 3, installing them in municipal buildings to start, and then providing education to the community as you kind of roll them out. It's a really great way to get people familiar with this initiative and a little bit more comfortable having this conversation in communities. So that's what the boxes look like. They sort of look like an AED, but they have a clear front. There is a breathing shield inside. The data shows that just because there is one of these opioid rescue kits mounted in a building, it does not increase the risk of overdose on site. This Narcan is for people to take and carry with them, or for people who use substances to take and use if necessary. But this does not increase the risk of overdose on site. This is a public health initiative to get this Narcan into the community. So oftentimes people will just take the breathing mask out, keep it in their first aid kit, and then we fill that with about 4 boxes of Narcan, which is 8 doses total. We also distribute fentanyl and xylazine test strips. These have become a really, really important thing for people who use substances to have in their toolkit. We do have the capability to test the first 6 major components of substances with the help of a machine that we have at ASGCC, and we do know that the substances on Cape Cod are extremely contaminated. So anybody who uses drugs is at risk potentially for overdose. So having these tools so that people can test substances has become really, really important. So that's it for my presentation. Thank you so much for listening tonight. I will absolutely take any questions. I'll also share my email, or Carrie can share my email. And if anyone has any questions, or you're interested in having a further presentation or presenting on something different that, kind of piqued your interest, I'm happy to do that as well. Oop, I thought that was a stop share, but I guess not.
Okay, I'm going to open it up to the board. Do we have any questions or comments?
No questions, but as a local nurse here in Harwich, actually, I would love to get your email and send a few messages back and forth and get some more details about some of your programs.
Yeah, absolutely.
All right.
Ron? Any-
Have it, Carrie?
Yes. yeah,
Send it
I
to
will-
me
I
at
will
some
send
point.
it to
Thank you,
yep.
Eliza. I really
Yeah.
appreciate the information.
Yeah, you're welcome. I'm really looking forward to some further collaboration. There are, this has been kind of it's been kind of a slow rollout with some of these funds that, have trickled into towns. And I feel like we're now starting to kind of get our feet underneath us with this. So, what's in the future hopefully is collaborative and helpful to the community. So
I
thank
feel
you
like
so much for
anything
having me
along
here.
These lines is such a huge asset, and I work for Harwich Health, and we're in Harwich,
yeah.
Wellfleet, and P-Town, so would love to talk further with you.
Yeah, sure. I just did a presentation we work closely with Outer Cape, but I did a presentation for their Wellfleet group about xylazine last week. And so, yeah, always lots to talk about. I'm looking forward to talking to you. So,
Thank you, Eliza.
yeah, sure.
Okay, I have a couple of questions and some comments. My first question is, where are these boxes located that you said are around?
So I can answer
Yep.
that, Eliza, if you'd like. They're
Yeah,
not
go ahead,
installed
Karen.
yet, but our plan is the community center for one, and in the women's and men's bathroom at the Chamber of Commerce for the others.
Is there going to be any place that would be available 24 hours?
No.
No. So this is more or less just to get to have, and this is not for an emergency use, so to speak.
That's right. So the idea with these boxes is to kind of saturate the towns as much as we possibly can with community members who are carrying Narcan. We know that a lot of people use substances in public spaces. They don't necessarily use them at home. Our highest kind of like reporting of overdose is, public restrooms, sometimes cars, parking lots, etc. So the likelihood of encountering somebody who's potentially experiencing an overdose in the community has increased substantially the past, 10 or so years. So having a community where people know where to get Narcan, if you know someone who's using substances, perhaps you live at home with somebody who's using substances or in recovery, it's always a good idea to have Narcan at home. If you have family members that, have prescriptions for opioid medication, it's a great idea to have Narcan in the home as well. And Narcan works on opiates and only opiates. So it is safe to have around kids. It's safe to have in public spaces. It's safe to have around pets. It does one thing and one thing only. So.
Okay, and then you mentioned that, is there a place where they can come and get it from you? Do you have locations? With
Yeah.
that in mind, can this be put on our website, that if somebody is interested in this, that they could go to the town website, the front page, not where we have to try to work our way through that, so that they know where to contact, where your locations are, maybe with location addresses, phone number, and then once we have them at you said the community center,
So we'll probably do a news and announcements once we get them installed for the homepage.
or,
But Eliza, I believe the information is already on our website in the resources link. We do have a lot of resources that we try to share, so if we put everybody on the homepage. And
is that resource- is
our
that
transition from the old website to the new website was not clean, so we are doing some working on getting that.
So the resource page is going to be easy to find, to locate?
We're trying to make it easier to
All
find,
right,
so we're
okay.
working on it.
Okay.
Yeah, and on the boxes of Narcan, the kits of Narcan that we distribute, they also are stickered with contact information, where people can call for support, where they can get more Narcan, et cetera. I mean, ideally, like I said, when we kind of roll out these boxes and we get them mounted, it would be nice to have kind of an invite to the community to come hear more about, Narcan and why this initiative is important, et cetera. So, people are certainly welcome to, like I said, we are in Harwich during the week anyway. So, if there are folks that are interested in carrying Narcan, we're certainly happy to meet people, to make deliveries. I know that Sue, the town nursing office, she has a couple of cases that she keeps and she can distribute to folks if they're, if they express that potentially there's an interest or a need.
So that before we get a chance to get it on the website, is anybody that might be listening tonight or that might view this later on, can you provide information where somebody listening would be able to contact you? You say you have those little vans going through, or how, if somebody wanted it
Certainly.
now, tomorrow, to contact
But
you?
absolutely. So we have a brick and mortar site in Provincetown on Commercial Street. We also have a brick and mortar site in Hyannis at 428 South Street. We have a large mobile unit that services all of the Upper Cape area as well. But anybody who's interested in getting Narcan right away, like I said, we're happy to meet folks. Halfway, we're happy to make deliveries. They would call our Hyannis office, and the number is 508-778-1984, and they can speak to somebody there who will make arrangements for them to make sure that they get Narcan. We also have a website, asgcc.org.
Okay, good.
Yep.
Does do you have any?
Now, you mentioned that you can go into a drugstore and get this?
Yep. You can. So anybody in Massachusetts has a standing prescription for Narcan. So you are able to go into the pharmacy and you can get it over the counter. So if you're familiar with how to use Narcan, what it does, how it works, etc., that might be the easiest thing for you. So from what we know, sometimes they don't have Narcan in stock. Things are getting better in that respect, but historically, it's been something, especially in more rural areas, that people have encountered that they potentially have not been able to access through the pharmacy. Also, there might be a copayment, which is, it can be cost prohibitive for folks. There are insurances that are starting to distribute Narcan free of charge. Sometimes also people are private and they might not want to go into the pharmacy and ask for Narcan because, like we said, some of the stigma that's associated with that. So, we're all about reducing barriers for people. So whatever we can do, but yes, you can get it at most pharmacies.
Just as a follow-up to that, just in case I advise any patients, so they have a standing script, but that doesn't necessarily mean that their insurance is going to pay for it. They may have to pay for it out of pocket.
That is true. So most insurances still do have a copayment. What that is depends on your insurance. I know with like Mass Health and Medicaid, I believe that there's no copayment, but I think that you can access just one kit per month. And that might be fine for people. Narcan takes a really long time to expire, so that might be good for someone. Narcan also in the coming year will most likely be available over the counter, but that will also be cost prohibitive for folks. It's looking like it's going to cost about $75 to $100 per box. So, there are options there. You can also buy it on Amazon.
Thank you.
Yep.
So for people that can't afford it, what do they do?
Call
So
away.
people that can't afford it, that's a big part of why we exist. This initiative is, a public health initiative through the Department of Public Health in Massachusetts. So that's kind of where we come in. For folks who can't afford it, sometimes with like Mass Health, Medicaid, if you tell them that you need them to waive the copayment, they will do that. that's why these nalox boxes are really important as well. That's where they come in because they are cost-free, they're anonymous. We don't require any, that people give us any information. They just take what they need.
Last year at our flu clinic, we also had Eliza give us a supply of the Narcan kits, and we gave those out at our flu clinic for anybody who was interested or wanted some more information. We had Eliza incorporate a presentation and offer Narcan to our restaurants when we did our Choke Saver this year too, so that's something we'll probably be doing more regularly with our restaurants as well, is getting them training and supplied, so.
That's good.
And once they're set up, how often are those nalox boxes checked to be restocked?
Yeah, so we check them on a weekly basis to start. Like I said, we're in Harwich already on a weekly basis. So we check them every week to start. We collect that data, which, also can really be an asset for the town because we obviously share that data with, the folks that we're working with in either the substance use committee or selects board or boards of health or whoever, partner in this initiative. So we share that information of what those refills look like. And so that way, we get a better picture of kind of like how much Narcan is being distributed into the community. And it also gives us an idea, like, do we need to talk about maybe getting more boxes in the community because this is really going fast? Or, is there a better, more visible space that these could be in? Or do we need to be refilling them, twice a week or, checking up on them more frequently? So. Yeah, for the first month or so, we come about once a week. And usually we start in buildings where there are people there who have our contact information, who can, give us a ring if they run out. I always like to leave a case wherever there's a box, just in case we're not able to get there. Say somebody comes and takes all the doses. That has happened before. And so that way somebody in the building can just go ahead and fill it.
Does anyone in the audience have a question? Okay. Anybody else?
No? Thank you very much, Eliza.
Thank you very much.
Of course. Thank you so much for having me. I will talk to you in the future.
Absolutely.
Thanks, everyone. Take care. Have a good night.
Take care.
You might do that work session.
Yeah.
Yeah, okay.
Okay.
Work session,
We're going to move to the work session. We're taking this out of order. Wait.
session with Margot Fenn and David Spitz on the local comprehensive plan.
It's going to be online.
So we got Christine Flynn here from the planning department and Margot Fenn. I think David was unable to attend tonight, but
Good evening. Thank you for having us. I'm Christine Flynn. I'm the Director of Planning and Community Development for the town of Harwich. Here with me tonight is Margot Fenn, who's also a member of the local planning committee for the local comprehensive plan. And we're just going to give a brief overview of the where we are with the local comprehensive plan. And basically what a local comprehensive plan is a guidance document for the town as the town works on its development and land use goals and objectives. And the local comprehensive plan provides guidance for the town in terms of growth policies, as well as when the town has to balance competing land use decisions in terms of setting priorities based on the community's values and its vision for the town. And when we talk about competing land uses, it could be housing, natural resource protection, economic development, water quality, as well as climate change and sea level rise. So it's definitely a plan that's going to be utilized as a resource document for local decision makers and boards to help make decisions, but it's also a resource document for the community, for members of the public, as well as boards and committees and decision makers going forward. And This process has started about 2.5 years ago. The town contracted Ty and Bond with Sharon Rooney as the project manager for the project. And the select board had appointed a local planning committee, which is chaired by Joyce McIntyre, and Mario is a member of the committee. And as part of the process, we have done several surveys and community outreach, 2 community engagement meetings that have been highly successful. We did receive a great deal of feedback from the community in terms of setting priorities for both housing as well as our natural resource protection and water quality issues. And we have also done, as part of this, we are updating our housing production plan and our open space and recreation plan as part of this process. And we are at the stage of looking to get some feedback. We do want to engage boards and committees to make sure that the work that we've done so far is reflective of the town's values, as well as any regulatory board's mission and initiatives. And we want to make sure that we're addressing any issues that you may have as a concern with your own board, or any challenges that you've identified. And so, we're at the end of the process, and so if you have any questions, please let us know. And Margot, if you have any thoughts or any ideas to add.
Just a couple things to add. I know David Spitz came a little over a year ago to meet with your board, and he did fill me in on some of the comments that he got, and shared that with the rest of the committee as well. As Christine said, we've been trying to go around to the various different town committees that would have an interest in this, just to seek feedback. I know Christine sent your board members a copy of the latest draft about a month ago. It's a lengthy document, and I know you probably have lots of other things to read. So, we are basically here to just listen and let you all tell us if there are, concerns. What I remember from what David's earlier meeting with you was that some of your members had expressed concerns about the implementation of the wastewater management plan, and how that ties in with growth, particularly with trying to provide additional housing in town. And that's certainly something that the committee has grappled with a lot, because we do have natural resource constraints. We have a limited amount of land that's available for new development, and there's a very strong stress in the plan to focus on redevelopment, to try to reuse our existing building stock to create housing opportunities. And that could be mixed-use developments in village centers. It could be higher density residential development in places where public sewering is available. But we're trying to walk that line between making sure that we're not creating making our water quality problems worse, while trying to address this housing issue. So, we have a draft. It still needs some further work. Our plan was to take it to town meeting in May. The selectmen still haven't decided whether that's going to happen or not, so we're waiting their guidance on that. But I think it will be either in May, or probably, if that doesn't work out, then probably a special town meeting in the fall. So we're just here to get your feedback.
The board, any questions or comments?
Moment.
How did this initiate? Are you the initiators?
It's Under the Cape Cod Commission Act,
Okay.
there's a provision for towns to do local comprehensive plans. It's not required, but there are some incentives for the towns to do it. It gives them some tools, some regulatory tools that you might not otherwise have, like, creation of districts of critical planning concern and that sort of thing. Harwich has had a series of local comprehensive plans. The last one was approved in what?
2011?
2011. So it's been quite a while since it's been updated. And the selectmen thought it was time, and so they appointed the committee about 3 years ago. And it took us a little while to get off the ground because at the time there was no town planner, and we were without a town planner for quite a while. And then we had one, and he left. So, and then we got Christine,
Yes.
which we're thrilled to have her. And
Thank you.
it's a wonderful committee. It's made up of people from all different walks of life. Some who were native Cape Codders and Harwich folks who grew up and went to the public schools here. Some of us are wash ashores, although I washed ashore almost 40 years ago, so I've lived here longer than I've lived anywhere else in my life. So it's a good group, and I think we've gotten a really good response from the community. We got over 1,000 written responses to the quite lengthy survey that we made available. And we heard some pretty consistent messages from the community, and the highest concerns, that rose to the surface in that public outreach was concerns about protecting the character and the environment of the town and providing more housing opportunities for people of all income groups. So that's really what we've tried to accomplish with the recommendations of the plan. As Christine said, it's an advisory document. It doesn't require the town to do what it says, but the idea is to make your local regulations consistent with the plan, so that there's sort of a bigger picture
Master plan.
sense of direction of where we're going.
I have a question, because I had been on the wastewater committee a couple of years back, and I know, like, land use and was one of the things that was in the CWMP. Now, I know that's being revised. I don't know where we are with the new revision, at what stage. But it seems like we've changed when, and maybe some parts that are going to be sewered. So how does that fit in? How are you going to finish your plan? Maybe or maybe the CWMP has to come first, but it seems like the two would have to work hand in hand.
They do.
If you're going to plan housing in an area where maybe it wasn't going to be sewered, it's now going to have, or not have to be, but should be sewered, or maybe be required. So how does your group with the planning work with where we are with the sewering and the CWMP that I believe was being in the process of redone, but I don't know where we are with that. But land use, and part of this was part of that. And it seems like for one to finish without coordinating with the other is you're going to be out of sync. So where does
There has been coordination with the Board of Water and Wastewater commissioners.
Yes.
And they gave us some quite specific feedback about the plan, which is being incorporated in the latest draft.
Okay.
I think we are going to have further discussions because right now, for example, we've got two big, potentially very big housing developments on the horizon, one town-sponsored and another one by a nonprofit organization, and neither one of them is in a place that has public sewering now.
Yeah.
And the question is, should they be? And are there other places in town that are more easily accessible to to existing sewer that might be better locations for.
Because I think once that CWMP is updated, that has to go to the county and then the state again.
Right.
So in order, it doesn't make sense, I guess, to make, that these decisions should be made before that gets sent to be finalized.
Yeah, well, the plan is not specific to, actual properties and specific locations in town, but it does make recommendations for doing follow-up, more detailed work in specific locations. So, for example, trying to do a study of some of our village centers. East Harwich, this came up probably, gosh, I don't know, 5 or 6 years ago in East Harwich. There was a plan that was initiated by a group of citizens there to try to redo the zoning there, to encourage more mixed-use development and, some better road access and a whole bunch of different things. It never, it wasn't approved by town meeting, and the reason why was by the time the planning board got through making their modifications to it, the very people who had drafted it in the first place no longer supported it.
Yeah, I
So,
remember that. I
Yeah,
remember that.
so, but there's going to be need to be that kind of follow-up work to get down to the nitty-gritty of where should new growth actually be encouraged.
Yeah.
And, I think we all have some ideas about that. And one of the recommendations of the draft plan as it stands now is that we want to have a follow-up group that is working with the individual town departments on implementation of some of the ideas and actions of the plan. So whether the selectmen are on board with that or not, I don't know at this point. But a lot of this is still in progress.
Is there anything that you can think of that would be pertinent for the Board of Health to think about or consider, other than, they have to look at the sewering, but until a decision is made as to where
Yeah.
the housing, and to me, that's going to be a big part of the planning, is the housing.
It is.
Yep.
It definitely is.
Absolutely. And I think for the Board of Health, in terms of water quality and other issues for fresh water, as well as our coastal bonds, it's really important to look at some of the environmental implications for growth and development. And we want to make sure that we're striking the appropriate balance within all areas of the town.
Yeah.
And as Margot said, this is a work in progress, and there are several different moving parts to this, but there is interface with many of the issues, particularly for housing and for water quality and for growth and development. And so, as Margot mentioned about the implementation committee, what we don't want is for the plan to be stagnant and to end up on a shelf.
Yeah.
We want to make sure that we continue to engage the community and to really look at growth and development in a very sustainable manner for the long-term future of Harwich.
Yeah, I think till they get the housing where they'd like to put the housing is what's going to hold it up. I think it's going to hold up the CWMP too, the update.
One issue that was raised we had a joint meeting with the Board of Selectmen and the Planning Board about a month ago. And one of the issues that came up in that meeting was getting some better management and perhaps regulation of Airbnbs. And, that's a role that I could certainly see this board getting involved with because it becomes, part of the Board of Health's responsibility to make sure that these accommodations are being, properly managed and tracked. Yeah. And I know it's a staffing challenge.
They're a very big staffing challenge.
Yeah, yeah.
The rental programs can be a very heavy workload.
Yeah.
Because it's inspections, it's how often do you do your inspections?
Right.
It's writing violation letters, following up on violation letters. I'd spent more time in court over housing violations when I was in Dennis than anything else.
Really?
Because there's
Interesting.
that much more follow-up, because when people don't respond to your letters, they don't take the necessary actions to make the corrections, they drag their feet, you end up having to go to court.
Yeah.
So it is a very heavy lift. It's not something that I think our department is opposed to. It's just if we could get the staffing to accommodate. And I know
Yeah.
my predecessor, Dr. O'Neill, did draft, a memo to the select board when she was here about what we would need to be able to implement that type of program.
Yeah.
So,
Presumably, it should, if it's set up properly, it should be able to create a revenue stream that could conceivably add to the staffing. But none of these details have been worked out. We have made a recommendation in both the housing production plan and in the local comprehensive plan that the town look at some other models. Other communities have put in place, bylaws to try to regulate B&Bs, or not B&Bs, Airbnbs, and, or these other short-term rentals. So, but anyway, you asked, what might be of direct interest to this board, and that's certainly one thing.
All right. Anybody else with anything?
Not at this time.
Okay. Well, thank you so much for your time.
Thank you for
Yes,
taking the
thank you
time to come in.
very much for your time.
Okay, thanks again.
Okay.
work session item.
Work session B, discussion with Patrick Orton, restrictions of SIGAs on town-owned land.
Front desk or podium?
Wherever you're
If you're
comfortable.
more comfortable, sit down.
Well, thank you for having me.
Thanks for being here.
We just saw a tremendous presentation on opioids and possible death and Narcan and, resolving those problems.
Yeah.
I, too, am presenting tonight on a similar issue on death and whether or not we can find alternatives to what happens when there are chemicals in the environment that are killing wildlife. So I'm asking the Board of Health, and you can help me with the actual wording. I use the word regulate the application and use of cigars, which are second-generation anticoagulant rodenticides on town property. As you know, rodent control is necessary. While the use of cigars are effective in controlling rodents, mice, and rats, there are secondary effects on non-targeted wildlife species. Cigars cause a slow death by internal bleeding. They leave a prey easily vulnerable to predators. And even after death, they remain toxic and cause secondary poisoning for whatever consumes the rodent. Cigars are used to target mice and rats, but these deadly poisons move throughout the food chain with destructive consequences, killing snakes, coyotes, foxes, birds of prey that keep Massachusetts ecosystems in balance. So that's my concern. I'm concerned about the secondary effects of these anticoagulants because they remain potent. Even after the rodent dies, they still are toxic. And there's plenty of data, whether you go to Tufts Wildlife Center, whether you go to Wild Care in Eastham, or whether you go to Audubon, they all have statistics on what's happening to our wildlife. In 2015, the federal government banned the retail sales of cigars due to the dangers posed to children, pets, and wildlife, but they remain available for license applicators, okay? Just recently, a bill has been filed in the Massachusetts House by Hawkins and Moore, asking that these be phased out for Massachusetts, okay? And they are supported by both Representative Luddy and Senators Julian Sear. So there is action being taken, even at the state level now, to limit the use of escars as a rodenticide.
I just want to bring up the fact that you did mention limit, not totally
Yeah.
ban it.
Well, we need to come up with a proper word so we can move forward, you know? Everybody likes to jump on the word ban and then say, no way, okay? But if we can begin, perhaps the town can set an example and not use escars on town property. I don't know.
I'm
but-
going to ask you a question. Do you know where and how much it's being used here in Harwich?
Harwich, I don't have the specifics on, but I do have the data for Massachusetts.
Well, all right, but we're not talking Massachusetts, we're talking
Well,
Harwich.
yeah. Yeah,
Okay,
I don't have-
I did look into that,
good.
okay? The only place it's being used in the whole town of Harwich, by the town of Harwich, is at the DW, all
Yeah.
right?
Yeah,
That's the only place, and only one place there.
yeah,
Now, that doesn't mean that it's not used within the town. If somebody is getting,
yeah, a restaurant
but they have to have licensed people to do it. My other question is going to be, what are you going to do about the rat population? Now, the rats and the mice carry a lot of diseases.
right.
A lot of them, all right? And if I look at that, having those rats running around versus using a little of this by a professional, limited use, limited, not by, and they can't be sold, it can't be,
That's correct,
all right.
right.
So right now, we only have one place that's being used, other than maybe somebody that hired a professional to come in and get rid of the rats, all right? What would be your solution to the rat issue?
There's CO, dry ice, there's traps, there's other sources of poisoning. I'd like to see,
No, wait, the other sources of poisoning, and what do they do?
they don't have the secondary effect that the,
Oh, yes, they do. They do. They do. And I'm not talking about the anticoagulants, the other ones. The issues is it takes a lot longer for the animals to die, and while they're running around, they end up dying out all over the place.
Right.
Versus what this does, they tend to go back into their burrow and die there. So I guess what I'm saying is, again, you've got to look at the pros and cons.
yes,
All right? What effect is going to have all these rats and mice if we don't have a way of getting rid of them? And I guess that's my concern. Now, if I thought that every homeowner that thought they might have some rats or mice decided to use this, then I think that would be a real concern. I don't see that here in Harwich. And I've talked to Link and Sean Libby, all right? And he
Yeah.
gave us the information. We know who's doing it, how much has been used, and where. Now, again, that doesn't, I can't speak for anybody I did have a neighbor that had a problem with some rats, and they called in an exterminator. But it was like once and done, so it's not being used like fertilizer. So I guess I come back to you with, I don't see a solution to the rat population without using some sort of herbicide or cidal,
yeah, rodenticide.
yeah, rodenticide, yeah. What would be your solution to that?
I don't have a solution, but, you know, rats have been around for a long time, and there are other products available,
But
okay?
there are issues with the other, is what I'm saying is,
Snap
there
traps?
are going to be other issues with those as well. And those more likely are going to be eaten by your coyotes and the fox and some of the other things than it is even these. I had a question on some of the information that was given here.
Yep, okay,
The one from Tufts,
right?
it said they report, and this isn't on you, this is on them. The report that over 80% of the birds of prey and raptors that were received for their care, they gave no numbers. Now, I don't know how many people have taken raptors into their clinic to be looked at.
Personally, I've taken 2 in,
2, all right.
and they were both dead.
Okay, but that's 2, so 80% of 2,
Well,
right? That's only 2. So what I'm saying is, to give this kind of information of 80% is not wrong. I'm
No.
not saying it's wrong, but it's misleading, because they're not giving me the numbers. They have not gone out and looked at the, collected hawks and just to go in to see who's been, whether they've been contaminated. The only ones they're going to see are the ones that are sick. And they're saying 80%, and 80% of, I don't know how many, 80% of 10 is 8. That's not a whole lot.
well,
80% of 100 might be totally different.
we lost an eagle, remember that?
Yeah.
Okay, due to rodenticide poisoning.
Yep,
And there was an article in the Chronicle about a rare hawk.
yep.
Why isn't it dead today?
Yeah.
We don't know.
Yeah.
So,
Now, all right, when you talk about things being rare, you've got to remember, we've had evolution since the beginning of time.
yes.
Things are going to die off. I don't want to be part of the reason why we're losing them. I'm not saying that. I'm just saying, I'm looking at, from a public health standpoint, I'm more concerned about that rat population, and the mice population, and the diseases they carry that you're going to be exposed to, than I am some animals maybe being killed off by this. Because I'd like to know how many, let's say even in the Cape and then Massachusetts, how many animals have they known to be killed by eating the secondary animals? How many fox, how many coyotes, how many, I don't think we have wolves, but whatever else we might have.
It's expensive to do the test. I took the hawks in and they said,
You're right,
It's expensive to
and I
do the
guess that's
test.
one of the things that, yes, there are secondary effects. There's secondary effects to a lot of things. There are secondary effects to taking chemotherapy for cancer, too.
that's right.
So, we keep coming back to the broad picture. To me, this is a more narrow picture. And I'm more, like I said, I'm more concerned about what those rats and mice are going to carry than I am the limited use that's being used that we're aware of here in Harwich. And I talked to Carrie, we can't even regulate that, can we?
No, so we still don't have the home rule advantage, so even if the board collectively decided they wanted to create limitations or a ban, we don't have that legal capability. So it's like the fertilizer.
Yeah.
Where we enacted that ban and
And
then
had to
had to
rescind
rescind
it,
it because
right.
we didn't have the legal authority to
Yeah.
act that, so.
So rather than saying, it's a bylaw or it's a requirement, you could say, we're not going to do it. Just-
But like I said,
I
why-
can make decisions on my own. Am I going to step
I
to the
don't
left
think
or
the
step
Board
to?
of Health can make decisions for the way that the DPW manages the transfer station.
Okay.
And if I really thought that the town was abusing it, I maybe would, try to talk to somebody, get them in as a group, but I don't think it's being abused, and I guess that's
Yeah, right.
that's another,
And I
that I'm looking
understand
at.
the DPW's position with all the,
yeah.
the trash they have.
Like I said, I did check into it because I had no idea how much or where it was being used.
good.
I did know it was, they had to have licensed people.
Yeah.
And there are certain requirements as to how much can be used near a building or near agriculture. And I think it's being used, what's the word I'm looking for? Used properly, but
Carefully?
appropriately, there's a good word, appropriately, to control the necessary elements that we need to control, which are the rat and the mice.
And there is a heavy population of rodents at the transfer
Yeah, oh,
station,
yeah.
as you would imagine. And I think
Yeah.
that's why they've gone to the extreme. And I don't want to speak on behalf of DPW, but I would imagine that that's the only thing that's being effective over there.
Okay,
Where they're not using it in every scenario just to kill, a small infestation. They're using it to manage a large one.
right, right.
So,
That's basically what I was told, that it's not being used indiscriminately.
Good. Well, that's good news for me to hear that
Well, I-
it's not around this building, it's not
Yeah,
around,
and I think it was good, by you bringing it forward, it also causes this discussion that lets the town people know that it's not being inappropriately used. And at least from my point of view, that's kind of where I saw all of this coming out, is that at least we can't do anything, well, we couldn't do anything in Harwich, but we certainly don't have any control on any of the other towns.
No, of course not, yeah. Right.
And I would suspect that, or hope, that they would be just as judicious as what we have been. And like I said, he's got a licensed, he gave the information, I have that on who it is and how much they've used this year, where
Right.
it was used. And I think it's good for the people to know.
Okay,
So it was good to bring it forward, and it's an education.
yeah, it is, you're right.
It's an education.
And I did not check into alternatives. I know, live traps, snap traps, I know about carbon dioxide, CO. I didn't investigate alternative poisons.
I did. I did. So I
Yeah,
felt like I needed to know something.
Maybe you could share that with me as well.
I can give you some of the information then that I'll bring it in
Yeah.
maybe next Monday.
Oh, all right, yeah.
I'll bring some in. But,
If you can email me, or do you want me to just come in, I can, yeah.
well, I got to get my junk together.
Yeah, that's okay.
But, like I said, I don't think the first generation is being used anymore. The second generation, what they found was they can use less of it,
Right,
and it acts a little quicker.
yeah,
The other methods that they have, other chemicals, like I said, there's still,
one of the ones.
is that the one
That's the one you had me.
that was the one I was going to have yeah.
thank you. Okay,
That was just part of it,
yeah, yeah,
but it's, then I had some other information on the other ones that you were talking about that can be used.
yeah,
But they found what that was actually, when I say dangerous, more widespread with the chemicals than this would be. And like, these
All right,
have to be in a contained, in a
Right.
trap,
right,
so that some of the other, be difficult to get to.
yes.
It seemed as though there's been a lot of thought behind its use, and the licensed people have to be trained on it.
We just need to train the hawks not to eat
Yeah.
to eat the dead mouse.
You know what is surprising, and I won't tell you how I know this, but I do. Very often when animals are in that state, some of the animals won't eat it. All right, now my husband's a trapper. He doesn't trap in Pennsylvania. He does in New York, and he did in Pennsylvania. And sometimes with some of the animals that were caught using
Yep,
this type of thing, and you put it out, they don't eat it. And he was surprised at that,
yeah,
because he used to do some critter control. And part of that was then, oh, all right, we'll feed it and they left it, some of them left it lay.
interesting, yeah.
Now, it doesn't mean they all will, maybe the hawks didn't, but I know the four-legged stuff did.
Okay,
But that doesn't mean maybe they wouldn't pick it up and play with it,
right,
but they didn't eat it.
yeah.
But it seems as though with this second generation, that I think they've been a lot more careful with it, and I think it's being used a little bit
Yeah.
better.
Well, it's still on the table for our legislature
Yeah.
of the state, and see where that bill moves through and see what happens.
Yeah,
But,
yeah, and then
you
then I don't know what we're going to do with the rats.
But until we have that home rule petition, if that is something that ever gets into place, we can't regulate
Yeah,
anything
yeah.
anyways.
Well, I'll tell you, I am, once again, have on the town warrant three citizens petitions, one being the fertilizer home rule petition, and the second being the pesticides, which includes rodenticides. So we'll see if that moves through
So
town
if
meeting.
that moves through and we get to a point where regulations are possible, then
Yeah.
discussions on these things may change, or if we
You
want to,
bring it back and look at it.
Yeah.
put it in writing, the limitations, we can look at
Okay,
maybe having discussions on limitations without overall bans if the board so chooses.
Yeah.
yeah,
But
definitely.
until we have that authority to make any regulations, we really
Yeah.
just more invited you out to be able to get you to voice your
Yeah, well, thank you.
concerns for.
Yeah, good, and I'm really appreciating your feedback, so thank you.
Yeah, I think
Thank
it
you
gets
for that
things
as
out to
well.
the public that listens to it. I'm surprised the number of people that do listen, because I've had people stop me and make comments. So even if they don't come to the meetings, it seems like some people are listening.
Yeah, or
And,
look at the recordings, yeah.
yeah.
Yeah, right.
And I think it's good for education that people know what's being used, how it's being used, and
How it impacts.
how it impacts them. So it's good education on both sides.
I think we'd be more concerned too about the homeowner use and the homeowner
Right.
application.
Yes, if,
What's
who
the
are
count
not-
there?
right.
Yes.
Yeah, what's happening. But I'm happy to hear Harwich is
yes.
doing a good job.
Yes, and I really, I got the feeling that I felt comfortable that they were.
Yeah, yeah, yeah.
So,
Good, good.
Yeah, so
All right,
anybody-
well, that's good news for me to hear, so thank you.
yeah, I did look into it. I spent some time digging into it.
All right, well, either Carrie can give you my email, or
All right.
I can reach out to you.
And if I get myself together between now and next Monday, I'll bring some in. You're usually at the Board of Selectmen meeting, so
Right, right, I will be there.
I usually make it to that, so, yeah, I'll bring some of the copies I have.
And I will come back to discuss and present to you, once again, the fertilizer home rule petition and the pesticide home rule petition. So I'll get that on the agenda before town meeting, okay?
All right, that would be,
right.
yeah, all right.
Excellent, no, I appreciate it, so.
Okay, well, thank you again.
Okay.
Thanks again.
Thank you.
All right, so,
The minutes of the
Minutes.
August
the minutes.
2024 meeting.
We can finally vote on this one.
Was that the last?
Yeah.
November.
We've only seen this a few times.
Why can't I find the rest of my, oh, here it is. All right, I think the one in August I wasn't at, so I don't know if anybody has any comments.
I know, seen this a couple times at this point. I move to accept the minutes for August 22nd, 2024.
I second. Vote?
Aye?
Aye. Oh, you said aye, okay.
So
And I-
3-0 for that.
All right. I don't think I had anything.
November
And then
19th.
November minutes.
Did I have anything on that? I don't think so. Is it somewhere? I think I was good with that one. Anybody with,
I didn't have any concerns. I move to accept the minutes for November 19th, 2024.
I wasn't there. You, okay, a second? Vote?
Oh, yes,
Yes, yes.
Aye?
All right,
aye, aye,
all right,
finally. Get all that stuff out of the way.
all right.
All right. Okay. Old business,
None?
No. New business.
new business,
Okay.
under new business. Bedroom definition.
And I think we did discuss this. And I
Yes, we
think
did.
this was, if you look on the draft, I think the only thing we changed was on page 2,
Yeah.
where we added that not limited to.
Including but not limited to.
Yeah. And I think with that, I think we were okay with everything
Yes.
else. Do I have a motion?
I motion to accept the Harwich Board of Health bedroom definition as presented today, February 20th, 2025.
A second? Vote?
Aye?
Aye.
Aye.
All right. Okay.
B, revisions to regulations for private wells. Vote to accept proposed modifications, permit fee removal, and additional testing requirements.
Okay, comments? We'll start at the end of the table. Comments?
I don't have any comments or questions on this one.
The only things we changed were the fee that we took out, so we could have control over that fee in our fee schedule, if we wanted to ever make any changes to it. Instead of rewriting the whole regulation, we could just control it there. And then we added VOCs to the testing requirements.
Okay, I have comments, obviously. Okay, I'll go to the easy one first. On, these pages aren't numbered, but it's on the,
So almost the last page.
almost the last page.
So it would be
Not the very
front-
last, but the,
The front of your last page.
there you go, the front of the last page. It would be in number 2 of the existing well rental properties. And what was the wording we came up with?
So I think what's in there was results for all water quality tests shall be made available.
And my concern with that is, it would be available, but I think for rental properties and lease, it should be automatically given,
So supplied to Board of Health and to any and all tenants was the language
rather than
that
just
was
available.
proposed.
In other words, that they do have to give it to whoever's renting or leasing and the Board of Health. That was my only concern on, not concern, but, yeah. And then, on,
This page.
yeah, that page, since they're not numbered. It's under water quality. It's got a box.
Box with
Oh,
highlights.
Okay. We've had some people talk about the PFAS, and I thought maybe, even though we're not really ready to do anything or say with PFAS, all right, the state has made some regulations that the cities are going to have to do some testing, have that done within 3 years, and then anything that needs to be done has to be corrected within 5 years. So they've also added, and now Harwich does quarterly testing for PFAS. There were 2 new ones that this state wanted testing for, which they hadn't been doing. I do not know if they're doing it now, but I know they were planning to. But putting that aside, I thought that for rental properties, or when they're being transferred, I think it would be nice to have that information, a requirement for somebody, if you're going to sell the place and somebody's buying it, for that PFAS to be tested. And I think for rental properties, we already say that they want, where was it? Was that over here within every 2 years?
I mean, it's tested regularly, right? Like for the region, you're discussing the seller giving the potential buyer that information.
Yes, yes.
Like that information is available if somebody were to go look it up. You're just saying, if there's a sale,
Oh, no, I'm talking
There
about
would
for,
be an additional testing that they would
Okay.
have to do.
if
And
if they have
Individual.
wells, if they have wells, all
And
right.
I think that it's an expensive test to add. So if we could control it in a manner that the language was written for the transfer of a property, PFAS shall be tested if the Board of Health or its agent deems it necessary. So not saying that every transfer has to test for PFAS, but if we're starting to see concern in our drinking water somewhere else, and we know that there's an area
there's a
of
specific
concern.
region that we
Yes.
see a well coming up in, we can say, all right,
Yeah.
this region's under suspicion, we've seen some
We
higher
have that
testing in this
power.
area.
So
We
far,
wanna have
Harwich
this
hasn't,
one tested.
Harwich hasn't seen any, but I know there's an issue in Hyannis. What I'm saying, if there would be something here in Harwich that we see, then,
Gives us a choice.
Yeah,
And then-
I think if the water supply is getting tested somewhat regularly,
Yeah.
then I think, sure, if we're saying we see some positive testing in an area,
Yes,
then making that report
Yes.
mandatory.
Yes.
I would agree to that. I don't think broadly
No.
making it mandatory would be fair if that report is widely available as it is already. But
Yeah.
sure, if
Yeah.
there is already some higher concern in the area, I would get behind that 100%.
yeah.
And Barnstable County is rolling out a program for PFAS testing
was
in
what- yeah.
private water wells. So I don't have the full details tonight, because I was just reminded of it when I was talking with Sharon, but I'll put that on my update for next month, the details of that program, because they are looking for volunteer properties to pull samples to test for PFAS. So I'll have more detail.
And that would be nice, because even though we're testing our town water supply, just kind of like the issues, and I don't know where it is in Hyannis, but I know they have some issues in there that they're dealing with. Without having some testing done, you don't know if some of the outlying areas are having problems with that. When you look at where PFAS is coming from, it could be anywhere. So, if they do that on a,
Yeah, that's the goal of the Barnstable County, is to try to highlight different areas
Yes.
that might be of concern.
and then if we know, let's say there is an area, then I think those would be the areas if a house or a workplace, whatever, is going to be transferred or sold, then I think it should be tested for the new person. And I think on rental properties and leasing, then I think we would have to look at that as well. If it showed up that in that particular area, we have an issue.
And again, adding the language that it shall be tested anytime the Board of Health or agent of the board deems necessary.
Yes.
That gives us the flexibility to, any scenario,
Yes,
say, no, I think we need this testing done.
yeah. So that was the only thing things that I kind of felt that we should put in here at this time.
How many wells are there in Harwich?
For consumption wells, maybe 200. That feels like a high estimate. We don't have a full comprehensive list because some wells were installed prior to the requirement of permitting.
So grandfathered in?
So we've done permitting, I think, the last 20 years, 30 years. So anything that's been installed in the last 30 years, we have record of.
Okay, before that you don't.
We don't.
So what happens if one of those places that has a well that did not require,
It's not required.
yeah, if that now is getting sold, then what?
So if it has a well, the Title V inspector is required to make note of that. So if a Title V inspection's done, we have no permit on it, he says there's a well, testing is required.
Okay,
So we'll see that it's noted as a well. Most of the Title V inspectors in town know that they need to supply us with the water results as part of their inspection. If it's not attached, we hold it until we get it.
all right. So that would catch anybody that's been over, like you said, over that 20-year, that wouldn't have been permitted, all right.
Yep, because the Title V inspector will do that.
Before-
Yeah.
We'll pick that up, all right.
That's good. That's safe, fail safe. Okay.
Yes, yeah.
Good.
So
Okay.
in this case, if we were gonna include that in this right now, looking at what we've got, would we move like 6 to 7 and put in a number 6 saying, in the case of
Yeah.
a sale of the house, the Board of Health has the right to require testing, upon discretion.
So you can
And
come
would we
up
say
with
it's
the,
mandatory if there's already been some high PFAS, or just across the board upon discretion of the Board of Health?
I think if it's with our discretion, we're not going to require it if we don't think it's necessary.
all right, so let's say, maybe after they do the free testing and that we have an area, there's a problem, and this would come up. We could mandate, then it's not just at our discretion, we can say it has to be tested.
Yep.
All right, yeah. Then do you want to come up with a wording?
Do you want me to do a revised draft for next month's meeting?
Yeah,
Just to be
With-
sure.
with something that states that we, if, or at any point, we have the right to require the testing be done, so
Yeah.
that upon discretion, you know, if we see some higher testing in the area, that we can require upon sale of the house.
Yeah.
Specific, you know, especially a place with a well, that we can require that testing. I think that would
Absolutely.
be
Makes sense.
Yep,
appropriate.
we'll do those revisions. We'll add that item in under water quality testing, and we'll make the modifications to the language for the
rental
water
properties.
quality result tests for providing to the board and,
Yeah. Those are the only two things that I had thought of when I looked through this.
yeah, reading through it, it doesn't need a lot of changes.
No,
just-
I didn't think it did.
Yep.
I didn't think it did, but like I said, those are the two things that popped into my head.
We need to make a motion on this to send it to next month.
For next,
With revisions, yep.
I move to postpone the vote on regulations for private wells until next month with the revisions regarding testing of water quality upon transfer of real estate and revisions to water quality and a need to test
PFAS.
based on discretion of the Board of Health until next month,
okay.
March 2025.
Sounds like a motion.
Second?
Vote,
Aye?
Aye.
aye? And you're going to put PFAS in that?
I'm going to put PFAS in there.
Yes, okay. I want those, only because people have asked, they have come and asked about that, okay.
So we will address it without making it a requirement, but it will be at our discretion.
All right.
Health Director, report.
So I have this at the bottom, but I am going to start it at the top for our staff update. It saddens me to say that Meredith has left us to take the health agent position in the town of Orleans. This is a great opportunity for Meredith, and the town of Orleans is very lucky to have her. This will be a loss for our department. Meredith has been an asset to our department and has strengthened relationships with community partners and other town health departments. So, happy for her, loss for us.
Yes.
We have a community action plan, so following up on our public health needs assessment, we have finalized our contract with Crescendo Consulting to work on the town of Harwich, with the town of Harwich staff and various community partners to develop a strategic response to the needs outlined in the Lower Cape Public Health Needs Assessment. We will be holding a stakeholders meeting on Monday, February 24th. Our DPH summer intern, our application for intern was accepted for our social media campaign. So we're excited to see what happens with that. We had the DPH intern last year who did some opioid research for us. And she did a phenomenal job with that research, so we'll see what this intern is able to provide for us. We have, we had the stroke awareness and prevention presentation. We hosted Christine Skaminski of the VNA to present to the community members signs of a stroke and what to do if symptoms occur. This was held February 4th at 1 p.m. at the Harwich Community Center, and there were 10 residents in attendance.
She's wonderful.
She
She
is
used to
great.
work at
Yeah.
Cape Cod Hospital,
Yeah, she's got great energy.
yeah. I know. If only I did.
Correspondence.
None.
Permits as printed.
These are new licenses first. And then we have our renewals. So I want to do the new licenses as printed. We have a couple of event permits, a new food permit. We have Twisted Pizza, who is going into, I forget which location he's going to. This is when I need Jen here. And a couple of new septic installers. Where's Twisted Pizza's going into?
Is that my
Right. Devin Corliss.
So we have a
Any
motion to.
Questions or comments on these from the? I motion to accept the new permits as presented, February 20th, 2025.
Second?
Vote?
Aye?
Aye.
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 We have the renewals. Make you read the list of them.
Have on the TV.
Wow.
Yeah.
That many issues previously. Unless there's anything you feel you need to bring up regarding to this, Carrie, I move to approve the renewals for permits as presented February 20th, 2025.
Second?
Vote?
Aye.
Aye.
Aye. Other.
Anybody have anything else?
Is there anything anybody needs to ask, or?
I do have a question. On people, what's this, what do you call that when people rent at, I forget what they call it.
The
Airbnb. Now, do we regulate that somehow, or how is that private, or how does that work?
Yeah, so the building department has a short-term rental registration, and that was implemented because of the tax that was required for people who offer short-term rentals.
Okay.
But there's no inspection, it's a registration, and they,
So it's more of a private type situation,
yeah.
so it's unregulated, more or less.
It's unregulated in some sense, but anybody who is an occupant of a building that shows up and feels that the conditions don't meet the minimum standards for human habitation can call the health department in that town and file a complaint. And as long as they are the occupant of the dwelling, they have the authority to let us in and inspect. So it's
Happened in the past, let's say last summer.
not with the short-term rentals.
No. So it's,
It's
They gotta
usually
do it while they're
it's
there.
usually the year-round rentals that we do more of the complaint inspections.
yeah, I've heard some bad stories. Long-term rentals, and you can't get people out,
Mhm.
and things like that, because they misrepresent themselves, so to speak.
They have rights, and without a good lease in hand, their rights are much stronger than the landlord. So
than they
we
are.
always recommend leases.
That, the information that I had you copy, that we gave a copy to, do you have any for these guys?
Yes, I did hand
Yep, she gave everybody.
Oh, okay, all right, okay,
just-
yeah.
just
I figured
wanted-
if,
Rodenticide received.
the, pardon?
Rodenticide received.
So, all right,
Adjourn?
motion to adjourn,
I motion to adjourn.
Second?
vote,
Aye.
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 All right.